So I am here representing the undergraduate major in biology of global health. It's a degree program that we've been running for about 12 years within the biology department. And most of our students arrive on campus, probably 70%, convinced that they're going to medical school. We don't try and change their mind, although I think some of them definitely do end up changing their mind after they go through the program. What we try and tell them about are both communicable diseases and non-communicable diseases, and to understand both the biological drivers of these diseases, but also how social drivers or socioeconomic factors impact on both of these. When we were getting educated, infectious diseases were the big player around the world. Now they're on the way down by and large, not all of them obviously, and non-communicable diseases are on the way up. Some of that is biological and a lot of that is not. So trying to understand how those different factors interrelate is really what the program's about. Because we're the biology department, we do emphasize the biology, but we want our biologists to understand that there's more going on than just the biology. And I think for our students, that's what's really the most eye-opening. In terms of specifics in the curriculum, we try and do things that are a little different, I think, than the rest of the biology curriculum, in that there is an additional math requirement that's not present in it, as well as an emphasis within our only required course for this major, the Gateway to Global Health, on communication skills and group work. And the students are doing presentations in various formats, podcasts, policy papers, as well as grant proposals, and more traditional sort of science writing. And in the end, the students are going off to medical school, but also to MPH programs and to NGOs in town. I fondly remember some of our alumni who are at either CSIS or the Sabin Vaccine Institute in town doing great work. And then I didn't put on the slide, but looking to the future, thinking about that more, has been trying to imagine, as we're going to hear of some of the master's programs that have developed on campus since we launched this bachelor's, is creating 5-year options. We do now have a BSMS option for biology of global health within the college, and then global health within the School of Nursing that Dr. Lisa will talk about in just a minute. And with the new infectious disease masters that Dr. Apter will describe, that there's an opportunity there, once that program's running a little better, to make another joint program and to find efficiencies in the teaching and the programming for the students.